Good afternoon to all of you, and welcome to Capdula webinar. So this is an important step for us as it's our first webinar in English. So some of the participants are regular attendees. Some of you are totally new, so welcome, and thank you for joining us. As you can guess from our name, our webinars are always about pain management. And for this first webinar in English, we're going to talk about pain and surgery. So I'm pleased to welcome the three lecturers for today, Professor E.Viguier, Dr. Philippe Buttin, and Dr. Thibaut Cachon, who are going to share with you some of the latest innovation in surgery, innovations which, amongst other advantages, can significantly help in reducing post-surgery pain. So the lecture will last approximately 40-45 minutes to save time for the question at the end. So if you have questions raising up during the lecture, please use the chat and we will answer as many as we can at the end of the session. So I'm now handing over to Victor Roballo from Novalig Surgery, our partner, who's going to introduce the session. Enjoy the meeting.
Thank you very much, Laetitia. So I'm Victor, the CEO and the co-founder of Novalig Surgery, and I will just briefly, say thank you to Capdula for the organization of this webinar and to all the surgeons for their participation and all the attendees. I will just briefly present our company, which has been created in few years ago in Monaco and which is benefiting of several decades of experience in human implant manufacturing. We decided a few years ago to dedicate this know to the veterinarian surgeon and to help them to maximize the benefit of this treatment or to minimize the animal pain, trauma, and recovery time. And this is why today, three surgeons will present you the physiological technique we developed for CCL repair, for tendon repair, or as well how we can manage the pain in post-operative surgery with cryotherapy breaks. I will now let E.Viguier, which is from the University of Vetagro in Lyon, France, who is working with Dr. Thibaut Cachon in the same university, and then Dr. Philippe Buttin will talk about the tendon. Philippe Buttin was a referral activity in the French Alps in France as well. Professor E.Viguier, I now leave you the speech.
Cruciate ligament rupture. Could you change slide, please? Oh, sorry. You hear me? Do you hear me? Change. Oh, okay. As you know, the rupture of the cruciate ligament is one of the most common. Don't change. Don't change. First, yes, the most common cause of traumatic lesion of the pelvic limb in adult dogs, and it represents a lot of money in USA. We can evaluate the price of this procedure for the clients about $2 or maybe more trillions of dollars. It was 1.73 in 2003. And the rupture of the cruciate leads to osteoarthritis. For the dog, it's painful, and the only way to treat correctly this affection is to do a surgical treatment. You can find many techniques, and it's more than 100 techniques to repair were described. And actually, the gold standard is the TPLO. As you know, the limit of the TPLO is a surgical trauma because of the section of the bone of the osteotomy, and you know it's painful. The procedure is not basic, and it needs some experience and a specific equipment. The duration of the post-operative sometimes could be long, and we know that we can find some major complication. Slide, please. So we have also alternative to the TPLO, and as you know, we have different ways to treat them. You can use an extraarticular technique, or recently we've developed a new way of intraarticular technique with new artificial ligaments. The flow techniques with an extraarticular technique is only used on small dogs, and if you do modified technique with 3-in-1 technique, by example, it's not enough strong sometimes, and the postoperative is sometimes not enough good. And you can improve the technique with the tri-rub technique and the tri-rub ligament, because you increase the isometry and it's better. Oh, sorry, I have no more slides. I have no more slides, please. Oh, okay. Could you change the slide? Okay. I don't see the slide. Oh, do you hear me? Sorry.
We have a small issue. I will send the slide.
I have no slides. Sorry. I have no, yes, sorry. So, before, well, yes. The alternative to the TPLO is the use of intraarticular ligament. You know, we have done before with the fasciolata for the over-the-top technique, but we know that the ligament is weak. And with the new ligament, it's possible to have a very strong repair and less inflammation than before with this ligament. The benefits of this technique are simple, fast, and less aggressive, no osteotomy, and a low morbidity. So in this way, you can have for the dog less pain. Slide. The CCL repair with the intraarticular ligament need for this technique some interference screws and ligament. In this technique, we will use ultra density polyethylene ligament, and this ligament is passed through 2 tunnels or drilled at the insertion of the cranial cruciate ligament. And the ligament is fixed with the interference screw. You can see on the X-ray a ligament fixed with 2 interference screws. Yep, slide. Victor, slide.
I think it's good.
We have developed some study with this ligament, and we have some results in biomechanics and in clinics. In biomechanics, we have proved that we can fix with 2, 3, or 4 screws, and the fixation with 4 screws better than 2 screws and 3 screws and 2 screws. The fixation of the quality of the fixation of the ligament is better in the femur, less in the tibia. With 4 screws for the fixation, we have quite the same maximal force that the native ligament. We can replace 4.5 millimeter screws when you lose it with a 4.5 millimeter in the same hole. We have also proven that in a dynamic study, after 100,000 cycles, we have no more than 2.5 millimeter of elongation of the ligament. It's compatible with the good use of the ligament. We have developed some new screws, and the strength is best than the old one. And we have also shown that the implantation of screws in the articulation from the insertion to outside is better than outside when you want to fix the ligament. In clinical research, we have developed a special guide to drill the tunnel to have a real improvement of the technique. The new screws are very easy and quicker to use. And it's possible to use arthroscopy to be less invasive and to have a best implantation of the screw close to the ligament. So I lose the picture. I need the... In conclusion, I want to tell you that this technique is simple, less aggressive than in TPLO. It's possible to do with a traditional approach, with a mini arthrotomy, or with arthroscopy. With this technique, we can say that it's less pain for the dog, and we have an easier recovery. You can look at the first picture, the technique with arthroscopy, and the dog who has been repaired. So the problem with the video, yes. Yeah, thank you for your attention.
So, Professor E.Viguier, we can check if you want if there is any question in the chat.
So there is no question?
We had one question back to Professor E.Viguier, which was concerning the outcome like after surgery of the CCL and physiological repair and comparable to TPLO. Professor E.Viguier, I don't know if you can hear us. You have your microphone unused. Professor E.Viguier, can you hear us? All right, we can hear you now.
I increase the volume. Yes.
Now we can hear you very well.
Where is the question?
The question was asked by Dr. Joe Fox.
Yes.
What are the outcomes like after surgery? And is it comparable to TPLO?
Hi. So concerning the outcome, during the first 4 weeks, the problem is that the dog must be very quiet because of the quality of the fixation. The fixation is only maintained by screws. We are sure that now the new shape of the screws allow us to have a fixation, a good fixation for the trot, for the walk and the trot. But if the dog is quiet, the fixation during the first month is enough. After 1 month, you have the soft tissue and fibrosis who comes in the ligament and create a wound or wound healing between the bone and the ligament and maintain strongly the ligament. So the post-operative is quite the same as post-operative that we had before with the fasciolata, because we have not enough experience for the moment to be sure that we can have a recovery quite the same at 2 months. The ligament is strong, the fixation is strong, but we have not enough cases to tell that now you can let the dog with a regular activity at 2 months. So for the moment, we must be careful during the 4 first weeks, and after increase progressively the restriction, to decrease the restriction of activity and to increase the walk, increase the trot, and after the dog will be able to run normally.
Thank you very much, Professor E.Viguier. We have another question for you. How many cases still know maximum follow-up and rate of infection in your practice? Any acute breakdown? This is a question from Dr. Vincenzo Santoro.
For Buttin or for me?
For you, Professor Vicky.
I am looking for Vincenzo. How many cases till now? Yes. For the case, the problem was not the infection. The problem was more slipping of the ligament, because we had the old version of the ligament and the fixation, and we use the same way of implantation that total hip prosthesis. So the problem is not the infection, but was more the slipping of the ligament for some dogs, and particularly the large dog. It's the reason why we have modified the technique and modified the screws. It's not a breakdown, it's more slippage.
Okay, thank you.
Okay.
Well, if there is no other question, I think we can finish now. Thank you very much to the three of you for your conferences and for the time you spent into the question and answer time as well. Thank you to all the participants to this webinar and to Capdular for its partnership for this webinar as well. You can access to this webinar as a replay video as well. Novalig Surgery will try to implement webinar each month because of the period we are living right now. Webinars is a good way of sharing experience. So thank you very much, and we hope to see you again in the next one.
Thank you. Bye.
Thank you. Bye-bye. See you.
Thank you.